Hi there. My name's Carl. I'll be your student nurse today. I hear that you have been having some cardiac issues, some heart troubles.
Yeah, I feel a little like a heart's coming out of my chest or it's fluttering.
Fluttering?
Fluttering,
Oh,
yeah,
okay.
like flutter.
Alright. Well, what I'm going to do here today is after getting a set of vitals, we're going to ask you some series of questions, and then I'm going to run through an assessment of the function of your heart and vessels, okay?
Alright.
Alrighty. Before I do anything else, I'm going to look at your band here. Can you verify your name and date of birth for me?
Andrew Pauling, 9/16/84.
Awesome. Alright. Do you have any allergies?
Allergies?
Mm-hmm.
Not that I know of.
Okay. Alright. Just want to make go forward because this is made of latex.
Okay.
And I want to make sure you didn't have a latex allergy.
Oh, okay.
Alright. So what I'm going to do first, I'm going to start with just a note for the camera. I don't have a thermometer or pulse oximeter, so I will admit that I would also be getting those temperatures when I'm doing the vital signs, but for today's purposes, since I don't have the resources, I will not be actually. I'm going to go and get his blood pressure. And the camera person is my fiance. She's recording for us. She's going to let me know how close I am to 15 minutes. Alright. Looks like we have 122/84. Alrighty. So what I'm going to do is ask a series of questions. Where's my notebook? Excuse me. Alright. As you see, it's blank. So I will not be using any cheat sheet. Alrighty. So, Mr. Bowling, how old are you?
30.
30, alright. You said you had no known allergies.
No allergies.
Okay, are you currently taking any medications?
No medications right now.
Are you a smoker?
No.
Alcohol use?
Yes. Yeah, I do that.
How often?
I'd say 3 times a week or so.
Okay. Okay. You say your main reason for coming in today is you have fluttering in your chest.
Yeah. Every once in a while it feels like it's jumping out even.
Okay. Any pain associated with that?
No pain. It just feels uncomfortable.
Okay. Since you say it's uncomfortable and it's a symptom that's causing you concern, I'm just going to ask you a series of questions regarding that. When did this start?
It actually started happening just yesterday.
Just yesterday, what were you doing?
Well, finals are coming up, and I don't know. I was just studying real hard, trying to get it all in.
Okay. Anything that you've done to make it go away or get better?
No, it hasn't gotten
It hasn't gotten any worse.
No, it hasn't gotten any worse, but it hasn't gone away.
Okay, does this fluttering, does your heart beat fast?
I feel like a jump every once in a while, you know.
Okay.
I don't know about quickness. I haven't felt my heart to feel any quickness.
Okay. Do you have any fatigue or feeling tired?
Yeah. I've been, studying for finals and just keeping myself up. That could be it, though. I don't know about.
Okay.
Alrighty.
How about any dizziness?
No dizziness.
Okay. So on a 1 to 10 scale, when you're comparing the frequency or the reason it's causing you hindrance in your daily living with your palpitations, what would you give it, from 0 being not at all to 10 being it's hindering you completely from doing everything?
Well, about I don't know about hindrance, but I'd say 3.
Okay. Now, is this a constant thing or does it come and go?
It's been consistent since it came up.
And how long has it been going on? You said since just yesterday, right?
Yeah, yesterday morning.
Have you had any pain show up anywhere else in your body?
No pain.
Okay. Just making sure. Alrighty. Do you have any family history of cardiac issues in your family?
No, not that I know of.
Okay. Thinking here. What was the last thing you can, like, what kind of stuff did you consume the last 24 hours? You can walk me through from breakfast, lunch, and dinner.
Well, my diet's pretty bad, actually.
Okay, how is it bad?
I had a bowl of cereal yesterday.
Okay.
And then nothing until 8 at night.
Okay, and what'd you eat for dinner?
I had like a couple Hot Pockets, and I've been having. I drink Rock Stars all the time. You know what Rock Star is? It's like a
energy drink.
Yeah, the energy drink, right?
Okay. So, about how many cans a day do you consume of that?
Well, lately it's only been since finals came. I'm trying to stay awake. It's like maybe at least 2 a day.
Wow, and how big are these cans?
I don't know. It's a bigger can than the normal.
Okay, so it's like the as they call the BFC.
I don't know what that is.
Oh well, I'm just trying to understand. It's one of the larger cans.
It's a larger can.
Oh, okay. Alrighty. So I made notes on everything. I feel like I've covered everything pretty well. So what we're gonna go do next is I'm gonna walk through an assessment with you. Okay.
All right.
What's my time at?
8:21.
Awesome. Alright, so here's what we're going to do. First things first, I need you to, if you don't mind, the shirt.
Okay.
Okay. Alright, thank you. Alright. So what we're going to do first is, I'm just going to go ahead and look over your general, I'm going to look at your periphery, and I'm just going to make sure everything's good, or color looks good, that you're getting good oxygen level. First thing first, I'm going to assess cap refill, since I didn't have an oxygen saturation. Cap refill is fast with under 2 seconds, so we're good. Alrighty. Then, need you to tilt your chin up for me. Alright, listen to that real quick. Alright. Let's see here. I need you to kick your shoes off for me too, please. I would have the patient remove socks in the normal circumstances, but for the comfort of the patient, as far as the protocol that we're doing for the video, I'm not going to ask Andrew to remove his socks. But I would remove them so I could adequately feel the pulse. Actually, I can feel the pulse pretty well, about a +2. +2 bilat on both upper and lower extremities. Alright, here's what we're going to do. I'm going to use the stethoscope to listen. Alright, you warm it with your hands for me. Alright, that way I don't cross-contaminate any bacteria or anything like that, even though it's just a stethoscope. I'm going to listen to aortic, pulmonic, move down to third for herbs, move down to the fourth for tricuspid, and then move down to the fifth and midclavicular line for the fifth, also known as the apical pulse, mitral. Then I'm going to review over it with the bell. And remember to lightly touch this area. I know no gallops, no rubs, no murmurs, also meaning I have not found any S3 or S4 sounds currently. However, I am going to now proceed to have the patient lie down on its left lateral side to assess the proximal maximum impulse point, also known as the apical pulse, and I'm going to also palpate that region as well. Okay, what I need to do is rotate, lay back, and then turn over to your left side just a little bit, about a 45-degree right there. Alright. And then I want to palpate that fifth intercostal space, about a quarter size where I'm going to feel the PMI. And it's present, and it fits in about that little gap region right there where my middle finger is right here. Alright. While the patient stays in the position, and for the circumstances of the environment, I'm kneeling next to him. Bell. I note no murmurs and no gallops, and a steady, regular pulse. And I'm going to listen for diaphragm. Okay. I'm going to have the patient lay flat, chin up for me. I'm assessing JVD. I note none. Alright. Set the patient up. As far as I know, I've pretty much done everything. I'm only going to do one extra thing, and that is while listening to his apical pulse, I'm going to palpate for his radial pulse and get and find out the deficit. I would listen for 60 seconds, let's just say that passed, and the patient has an equal apical pulse, radial, and there's no deficit. And I would document my findings, and in this case, I would say, Andrew, due to my findings, I have found nothing in my belief that is profoundly telling me a central cause. I'm going to recommend the physician overlook the fly-up, and we'll see what goes forward, and maybe even send you for further evaluation. This is the end of my video.